Hi, I'm Dr. Jillaine with Mobile Chiropractic and Wellness, where I bring chiropractic to you. So instead of a typical biography with my background and my credentials, I actually just wanted to talk about my why I wanted to go mobile, why I wanted to bring my services directly to someone. And to explain that, I think we kind of have to think about what you expect from a normal office visit, whether that's seeing your chiropractor or your medical doctor or any other therapist. So what we've come to expect is that you have to take time off to get to the office visit itself. So asking for, a couple of hours off to give yourself plenty of time to get there. On top of that, then you're also factoring in some travel time. So if anyone's traveled on Eagle Road, you know that that can be quite a hassle. So maybe 20, 30 minutes to get to your appointment. Once you get there, you are in the waiting room for 5, 10, sometimes more than that minutes until you finally get to see the doctor. Once you're in the room, unfortunately, sometimes you're only left with 5 minutes of face-to-face time with your provider. That makes it really hard to not only get to your visit, but once you're there, to feel like you are actually getting something substantial out of your care. In that 5 minutes, you're expected to talk about your primary complaint, the reason that you're there. You're expected to get your treatment, and you're also expecting to get some sort of treatment recommendations, when you should come back next, what kind of stretches you should be doing, things that you can do outside of care to help prevent your condition from coming back. 5 minutes isn't really enough time to do that. So in my personal experience and professional, I realized that I needed to do something a little bit outside of the box so that I could spend more time with my patients, giving them more direct one-on-one care where we were really interrupted. It was just me and the patient. We weren't worried about who was in the room next door waiting to be treated, and the patient doesn't need to be concerned with rushing back to work and trying to minimize the time away from work. So that's kind of where the mobile comes in. I'm able to come directly to someone, eliminate all of those hassles and inconveniences that come along with a normal office visit, and I bring my care to you, where I'm focused primarily on you for 15 or 30 minutes, where we're just working on you, and you are not distracted and I'm not distracted. So what that does is allow us to have more focused care, more well-rounded care. If I come to your office, I'm able to see what your office environment is like, what kind of chair you're sitting in, what your ergonomics are like. Is your desk set up in a way that causes you to constantly fall forward? Is that why you're having that neck pain and that upper back pain? Or if I'm at your house and I see you picking your kids up, and you're always picking up your toddler and throwing them on your right hip, is that a reason that you're having low back pain? So we're able to kind of assess and evaluate a little bit more thoroughly. I also get time to not only give you a quick head-to-toe adjustment, but we can kind of play detective, and I can figure out, are these tight muscles up here responsible for continuing to pull your back out of alignment? And if not this muscle, maybe it's a muscle in your low back that's actually causing some discomfort in your neck. And by treating both the muscle side of things as well as the spinal side of things, we're able to kind of give better outcomes for people, more long-lasting effects and treatment. Something that I've noticed with patients is that they feel like they want more out of their care. They feel like they deserve more. And as a provider, I'm feeling like, or I have felt like, I also want to give more care. And I think just what it boils down to is being able to treat someone more holistically, being able to give someone something that they're not expecting, kind of going above and beyond, giving a increased value and increased level of service. And that's what mobile chiropractic is all about, being able to bring that increased level of service directly to someone to decrease the hassle and the inconvenience for them and give them better outcomes and better long-term care. So if anyone's interested in learning a little bit more, I would be happy to do a 5-minute phone consult. You can call the phone number on the website and schedule that with me. And I look forward to meeting and serving the Treasure Valley.